Kary, why don't you kick us off with an introduction and we will go from there.
Sure. I'm Kary Rappaport. I am the lead senior feeding and swallowing specialist at Solid Starts. I am a pediatric occupational therapist by training and an international board certified lactation consultant. I have been working with infants and toddlers on feeding, eating, and swallowing issues for the entirety of my career, which is now over 20 years. And I've worked in a wide variety of settings, including outpatient clinics with children who have developmental delay, autism, severe picky eating, in home with families working with lactation, bottle feeding, picky eating, all sorts of eating issues. And then for many years, for over a decade, in large children's hospitals, in the NICU, the cardiothoracic ICU, and in the bone marrow transplant unit with patients who had cancer. So I have worked across a very wide variety of settings with a lot of different patients and a lot of different kids. I've seen typically developing kids and children who have developmental delays learn how to eat solids. So I have a pretty broad spectrum that I pull from. I also have two of my own children who are now quite big. They're 9 and 12. So it's been a little while since I was in it with the littles, although I still have tons of kids around me. So I'm constantly learning new things from the families I work with.
Does the feeding journey get easier as your kids grow up?
It gets significantly easier. It's one of the most joyful parts of my parenthood at this point, but there was a lot of effort on the front end to get to this point.
All right. Well, from your mouth to someone's ears. Hi, Dr. Manasa. How are you?
I'm good. You do get to do it again. And I will have to echo Kary's. I believe feeding is like the best ROI you can get in your child in terms of investing kind of early and often. And it can feel challenging in the beginning, but I think we talked about this last time, and Kary and I, our children naturally eat healthier, or they're more excited, or, daring to kind of do things. But that came from these years.
Yeah. So you put in the work now and you get the ROI later. I must say, I did get a this rocks from my 3.5-year-old for something I made last week. So that's a win. Okay, but your introduction, please.
Yeah. So my name is Manasa Mantravadi. I am a board certified pediatrician. I actually trained in pediatric endocrinology. So really in terms of treating children with type 2 diabetes, obesity, a lot of metabolic conditions, early puberty. And then in my pediatric career, of course, really taking care of general pediatrics. And so my career, I have kind of really shifted more from treatment to prevention. And now I practice what's called culinary medicine, a new, actually ancient form of medicine in which food is health and food is medicine, to really prevent disease in the first place instead of treating it. And so I always say part of my job as a pediatrician is to treat your kids when they're sick, but my bigger, most important job is to keep them healthy in the first place. And you can really start that at the family dining table. And I launched a company called Ahimsa, which is a line of stainless steel dishes for both babies, toddlers, kids, teens, parents.
I just placed a huge order.
Oh, did you?
Yes, because I just did that, like every few months, or like in my house months, somehow plastic just like resurfaces because it's convenient. I go through these purge sessions, and so I just placed an order. I'm so excited, literally waiting for it.
Yes, and that was, the reason I started the company. I wasn't looking to start a company, but it really came from the chemicals in plastic and the chemicals in our food system are really impacting children's health. And it is the formal American Academy of Pediatrics policy statement to avoid plastic and rather use glass or stainless steel. So, I always say I'm an accidental entrepreneur. I wasn't looking to start a company, but because the science and evidence was showing something, the market wasn't really meeting parents where they needed to be. So I took a leap of faith and started a company. So, but that's what I spend my time now.
Yeah. Well, I do want to eventually, I don't think we did this last time, but this time spend some time talking about pouches and how those introduce plastics and stuff like that. But first, let's start kind of with the basics, which for me comes down to knowing when baby is ready. So I guess for new parents, how do you know if your baby's actually ready to start solids? Like, should that come from the pediatrician or should you trust your parental intuition? Kary?
Yeah, I was gonna let Kary take this one. I
Yeah.
think Kary.
Yeah. I think we'd all agree that the research has really pushed us towards looking for developmental signs of readiness. So
Okay.
you should absolutely look to your primary medical provider for guidance on what those signs are. You should trust your parental intuition to a certain extent and maybe your friend network, but really truly what we're looking for are a certain set of developmental skills that show you your baby has what it takes to start exploring foods safely. So those signs, and they're just to put them in big buckets, are basically three main signs. One is just that your baby can sit up with enough head and neck control that they can kind of keep themselves up, look around, and participate in a meal. So it doesn't have to be perfect sitting. They don't need to be sitting independently on the floor on a flat surface without falling over. They can actually lean a little bit. They may have to put their hands down and prop a little bit, or you may have to put a little pillow around their hips, but they should not be hunched over or curved at their spine, and head should not be hanging down. So number one is they should be able to sit pretty well with some support.
Okay.
Number
So
two,
like support, can we just talk a little bit about that? Is that like a little one of those donut pillows behind them?
totally. Sometimes the high chair itself provides enough support. So there's just enough around them that they're not, completely toppling over. One of those boppy pillows around their hips, that can be the support. They can sit in your lap. That can be the support where you're just kind of holding them at the hips. All of that is fine. It's really more about their upper body. So if their hips are a little wobbly, if they're on the floor and they fall over, that's fine. As long as on your lap, they can keep their upper body up and not slump forward. So that should support the arms reaching out. So the first one is being able to sit up. Second one is being able to reach out and grab things. But what you'll see with a lot of 4-month-olds who are just starting to sit with some support is that they're so focused on the trunk, on keeping themselves upright and their head up, that their just arms are propped down and they can't lift them up at all. So you hold a toy up and they're just looking at it, but they don't reach out and grab it. Or if they do, they immediately fall over because they can't do anything with their arms because they're so focused on their trunk. Once you get a little bit more stability in your trunk, you should be able to do both of those things together. So being able to sit up with some support, being able to reach out and grab something and explore it with the hands and bring it to the mouth. And then what follows usually is interest. So because baby can sit up and reach out, they now are showing more interest in doing so for toys and bringing them to their mouth and for food at the table. So you often hear parents say, my baby's showing one or two of these signs at around, again, 4 months or early 5 months, but usually all three of those signs kind of come together in a baby closer to 5.5 or 6 months, even 6.5 months for some babies. Right in that range, the research says most babies will show those three signs all together.
Got it. Yeah, I remember my pediatrician, I had a really big baby, and at like 4 months, she was like, okay, you can start solids. And so I thought that I had to start solids. And in hindsight, we all know, or we're about to, it's a messy phase. And I don't really understand the starting super early. Is there like maybe Dr. Manasa, you know this, but like a developmental aspect of starting earlier?
No, the theory used to be a lot of what we know. So research is cool, right? Research and science and evidence is
Love
cool,
science.
right? So we have a certain philosophy or certain theory, we practice that theory, and then the evidence might show something different, right? It might say, oh, actually, and we'll talk about that later today when we used to think about food allergies, for example, or starting baby right at 4 months as a time-based recommendation, as opposed to what Kary said, which is actually a developmental and skill-based recommendation. So that used to kind of be the going theory, as these are the times to start, whether it's starting solids or delaying food allergies. But now what we're really seeing is a lot of that science is reversed, but just based on real data and studying lots of babies over time.
Got it. So I'm hearing don't feel pressured to start solids. And if you are, any words of encouragement? I mean, mine would be it's messy and don't do that to yourself if you don't have to right away. Kary, what would you say?
Yeah, I always encourage families if they say, you know, my doctor or my mom or my somebody told me it was time to start, to just ask them what they're seeing in your baby that makes you think your baby is ready to start. And that kind of helps you clarify if it is just that this is a recommendation they give across the board to all families because they believe all families should start around 4 months old, which is a really common
Mhm.
outdated recommendation. Like we are just saying, there's a lot of things that have shifted. So if your mom started solids with you at 4 months, she might think that's the right thing to do with your baby and then give you that advice. So it's okay to ask some clarifying questions there and let them know that the research has shifted. And a lot of times when it comes to advice from your pediatric medical provider, again, it's okay to push back a little bit and say, what are you seeing in my baby? Because there might be something specific. And if I'm telling you the general recommendations are look for those developmental signs, but your doctor knows something about your baby's history and development, and there are occasional exceptions to that rule, there might be something specific that is actually appropriate for your baby to start at 4 months. And I don't want to say all babies should be doing this if there's something going on with your baby that's specific. So just ask more questions.
Got it. And it could be your mother-in-law, which is even more triggering.
Yeah.
Yeah.
I think the other thing too is to remember that actually baby's primary nutrition really does in that first year, especially in that first 6 months, is breast milk or formula. And so that I hope allows to take some of the pressure off of parents, because as Kary said, mothers or mother-in-laws might say they need more food, they need more food. And actually what we look at in the primary care clinics, right, for our patients is, are they tracking on their growth?
Yeah.
Are they kind of, meeting developmental milestones? And if all those are true, food at this stage should be messy and exploratory and practice.
Yeah.
And I think if parents can understand that, it takes some of that pressure off to really feel like this is a fun journey, fun, messy journey, as opposed to, oh gosh, I have to be so hyper analyze about the nutrition that they're getting. And that's not really what starting solids is about.
Yeah, definitely. Okay, so you're at home, you feel emotionally prepared, your baby is now ready. I think a core question that I see time and time again at Augie, and especially because it comes with a lot of opinions, are around feeding approaches. So can one of you start by just walking through the pros and cons of, we're hearing a lot now of baby-led weaning, but versus traditional spoon feeding or even purees? And can you do both?
You want to go for it, Kary?
Sure. Sure.
I already have the
Um,
answer, which is both. So
Yeah.
she can give me.
exactly. Yeah. Spoiler alert, both are both's fine. But there really was only the traditional method in terms of what people talked about when I first started as a therapist. So the idea of baby-led weaning and this other approach is something that has really gained a lot of popularity in the last 12 years, 10 years. It slowly started to take off, but it's based on the way people fed a long time ago. So it's not new. A lot of people think this is a new fad, a new approach, which can feel a little bit scary, like it's untested. It's actually a pretty solidly ancient approach to feeding babies prior to the industrialization of food
I
and
know that.
processing. Yeah, so it's not a newer approach, but in terms of it being described and talked about, especially amongst the medical community, it really is new. It's only in the past about 10 years that it's really been out there. So a lot of people know of the traditional approach and thought that was kind of how it had to be done, which is essentially just an approach that suggests babies should start solids with purees, and you should spoon feed them for a certain period of time, gradually increasing in thickness of those purees. So that's the traditional approach. And people think of like Gerber stage 1, Gerber stage 2, and eventually you move on to mashed foods and then to small finger foods. The opposite of that, or the flip of that, is the idea of baby-led weaning, which is, again, an old concept that was coined or really described in the past 10 years, which is that when baby is showing these developmental readiness signs around 6 months, what they're actually ready for is a much wider variety of textures and foods than we originally thought. And the research has shown us now that that gradual increase in texture over time does not teach baby how to chew and is not necessary. That doesn't mean that the traditional approach doesn't work at all, or we should give up all of those things. It just means that that specific gradual increase isn't how babies learn to chew. So we don't have to exclusively do that. We can absolutely pull finger foods and start with finger foods, start with the more bigger pieces of food, offer more texture earlier to babies. And there's a lot of benefit to that. We know that oral motor skills from baby develop in relationship to the food sizing and the food texture that is served to baby. So that's where the idea of baby-led weaning comes in. I have been doing this a very long time. I'll tell you, number one, babies are very resilient. Number two, babies are driven to learn this stuff. So no matter which way we do it, they're going to figure it out. And number three, there are so many foods that are naturally pureed in our adult diets, foods that we come across like yogurt and hummus and soups, dips, sauces that are naturally pureed. So we don't want to avoid that texture. The only thing that we know now from before is that we don't want to exclusively offer that texture to the exclusion of finger foods. And we don't want to exclusively offer those purees for too long, because there's a window of time where baby is most developmentally ready to learn how to chew if we offer them other types of textures.
Got it. So that's like motor skill development and just got it. That makes complete sense.
And
yeah,
to
go
add
ahead.
on to the ancient
Yeah.
things, so I always tell new moms when I'm rounding on them and they're, about breastfeeding, and I think, Kary, you've been through this. I always kind of try to tell everybody, we've been doing this, guys, for centuries. Like
Yeah.
we have
And we eat.
and we eat every day. Formula was just invented, kind of in industrialization. My mom always says this is the original fork and spoon, right? And so when you really can wrap your brain around that, our bodies are designed to feed our babies, our children are designed to explore and kind of accept food. Again, it takes some of the pressure off, because I think a lot of the pressure around, whether it's breastfeeding, introducing solids, picky eating, is kind of this societal pressure. And if we kind of just remove that, it allows families to have that joy again at that dining table of food. And that itself goes a long way in that investment in health, when you really think about food as health and the ROI you'll see, in your 9 and 12-year-olds.
Yeah, thank you for saying that, because I do agree. And I think the pressure is real. And in some ways, for better or for worse, I do believe because of social media, this generation of parents is a little bit more anxious because they're seeing things, they're hearing stories more so than ever before. And I just want to quickly call out Solid Starts for this, because the peace of mind that the brand brings when introducing food is so key, especially for an anxious parent. Like, I actually lean more not on the anxious parent side, but my sister falls on the other spectrum. And like, that's great because she can do purees and dabble into baby-led weaning, and I can do baby-led weaning and dabble into purees. But Solid Starts really does tell you every step of the way how to cut things, how to like at different ages what it should be cut and how you should give it to your kids. So like a genuine recommendation to check Solid Starts out if you're anxious or not.
Yeah, I appreciate that.
Yeah, it's amazing. Now, what parents really need to know, and Dr. Manasa, you kind of brought it up in the beginning about like early I want to say intervention, but that's not the right word for allergies.
Yeah.
Yes. Talk to me about just like food allergies, leaning on to the anxious parent stuff. What should parents know about introducing allergens safely?
So this is kind of one of those what we used to think versus what we know now.
Okay, great.
So even honestly, when I was doing my medical school and residency, it was right around the time before these new studies came out, and you really were not supposed to be adding in allergens like peanuts at an early age, especially in those first years. But then there was a landmark study in 2015. It was called the LEAP study. And they really looked at exposing early exposure to peanuts between the ages of 4 to 11 months. They actually had a more than 80% lower rate of peanut allergy by age 5 compared to those who avoided it. So again, I'll use the same terminology. kind of traditional way of thinking versus, just new science and new studies that kind of showed something different. And so if you were in medical school back then, that's what you were taught. Wait until after they're a year or two old. And now it's no, actually do it early because it helps their body kind of get used to some of these exposures that they're seeing. So that's been, and I think now it's well developed enough to that is the recommendation. I think most parents have heard that. And so there's a lot of products out there that help you introduce those allergens kind of early. And I want to just like a quick note about allergies, because there's kind of food allergies and allergic response, which is really what we call an IgE mediated kind of immune response with histamine. That's the response that we really think about as allergy, meaning that the hives and the coughing and the wheezing and the, the scary anaphylaxis stuff, that's like a true allergic response. There's a lot of typical reactions and food intolerances that can happen that don't follow in that same category. And so those allergic responses are pretty immediate. So in general, we say we encourage you to introduce those early. The one exception is if your baby has severe known allergies like eczema or severe family history, it's something you should talk to your pediatrician about. So when you're introducing it, you can do it quite safely.
Yeah. Okay, because that was going to be my question next. Like, what is a typical sign? And then like if you're starting solids and your kid has one of these allergic reactions, like when should you intervene? And I see the question in the chat, and I just want to reiterate again, because I know we had some technical difficulties at the beginning. Feel free to write into the chat, and I will make sure that for the most part, everybody's question gets seen and heard and that you get an answer. So I will get to your questions and feel free to keep them coming. So anyway, it's like what's a scary reaction and what's a more average reaction?
Yes. So again, an allergic reaction is a immune reaction in which your child's body is reacting with their antibodies to produce a bunch of histamine that ultimately to a certain type of food, right? And there's a lot of common allergens out there. So things that we see kind of on the phone with your pediatrician or what we see in the ERs. So mild are like hives, rashes, like runny nose, sneezing. You might get some swelling around the lips, itchy skin. Those are kind of more on the mild side. Now the severe stuff, we'll see repeated vomiting or diarrhea, certainly trouble breathing, wheezing. If you see any sort of discoloration, like those are pretty significant ones. Those are like a call 911 kind of moment. And any of those other ones, you can talk to your pediatrician. Typically, severe allergies, you might have multiple systems involved, like you might have hives and rashes and some difficulty breathing. And so that's when we certainly want you to be coming into the, either the pediatrician's office and they'll call, we'll walk you through it, or the emergency room. Those are pretty immediate. And again, that's different than a lot of food intolerances. And some of the food intolerances can look like a mild allergy, which is why I think people freak out about allergies. And so if you're ever concerned, it's always a great idea to talk to your pediatrician, but certainly any sort of respiratory distress is something to kind of immediately call 911.
And then Kary, in terms of cadence, what is your recommendation there? Like if you're introducing peanuts on one day, when should you introduce the next allergen?
Yeah, we have an allergist on our team who I absolutely love and I've learned a ton from. So the recommendations that we give follow what she does in her practice. There's a few different ways you can do this. There's a more conservative approach, and then there's a little bit more of an aggressive approach, and she's okay with either, depending on what the family feels comfortable with. But with a more conservative approach, you start with a very small amount, just a little taste at first, and you're trying to introduce that same allergenic food. So there's 9 common allergens. So it's with these 9 foods, 3 days in a row. And with a slightly more aggressive approach, she likes to introduce them 3 times in a day. So you can do 3 times in one day, or you can do over the course of 3 days, but the repetition of that allergen matters. Now, that said, she is completely okay with recommending that families continue any food that you've already introduced that you feel baby has not had a response to can be served at the same time as that new allergen food. So it's not like it only, like if, for example, you're serving eggs for the first time, that you're only serving eggs, you could serve eggs and any of the other foods you've already introduced. She also recommends that unless you are extremely nervous about the whole introduction of allergens or the idea that your baby might have a response, that you could introduce a new non-common allergy food. So for example, bananas on the same day, say you've never introduced bananas before, you could introduce bananas and egg because those are not two common allergens. She just recommends that you do not introduce two common allergens for the first time together on the same day. So you wouldn't introduce egg and say yogurt, which is dairy, on the same day. You would wait until you've done your 3 egg days.
And what are the 9 allergens? Just so I know, I always put you on the spot with this
I
one.
know. Back me up, Manasa. We'll see if we get them. There's
Okay, I'll count.
Yeah. Yeah, egg, dairy, peanut, tree nut, wheat, soy, shellfish, finfish, and sesame.
Yeah.
That was really good.
Yeah.
Really good. So just quick question, if you're doing the 3 times per day approach, does she recommend that you introduce it in the same format? So like for instance, if you're mashing a little peanut butter in with banana, should you do that consistently 3 times or it doesn't matter?
It doesn't really matter. It's just start small and build up from there. And that it's the same like peanut 3 days in a row. It's not like peanut, then egg, then this, then back. Like it's the same allergen 3 times. So you could do it with banana in the morning. You can do just a little bit of peanut butter, a bite of it at lunch, and then, again, a little smear of it on your finger for dinner. It's just that you're getting it in a few times. So you're watching to make sure that there's no response over the course of a few different introductions.
And just talk a little bit about time of day, either one of you. Is it best, just in case there is some sort of allergic reaction, to introduce earlier in the day?
When you're talking about kind of the just overall society that we live in and kind of a lot of anxiety around everything, I always like to recommend, if it's something that you will make you feel better, certainly, breakfast and lunch, you've just got more time, because again, allergic reactions are pretty immediate. It's not, we typically don't see necessarily delayed hypersensitivity to like foods. It's usually an immediate reaction. So I think for those parents, certainly recommending kind of earlier in the day just allows you to be awake and alert and
Your
whatnot.
pediatrician's working. Yeah, that makes complete sense. Okay, you both were kind of talking about that the ROI on mealtime increases as your kid gets older. And we've been talking a little bit about how feeding can become this major stress point, especially if baby isn't interested in the food or feeding starts to feel a little bit chaotic. What are your tips for creating a calm environment and setting up yourself and your little one for success around an enjoyable feeding experience?
You want to go first, Manasa, or should I?
I can give some general, what I like about, so in general, just as a quick plug, I love, so medicine is a multidisciplinary approach, right, to health. And so your pediatrician, a registered dietitian, an occupational therapist, these are really like your teams, right? And so it's important because each one of us has different expertise, different kind of like what we see forest through the trees, and then kind of nitty gritty. So I love being able to talk like this, Kary, because I think everyone brings a really great kind of perspective on feeding. So I think from like the highest level, one of the biggest things you can do is role model for your baby, right?
For everything.
So for everything. And when it comes to mealtime, we know that eating together at least 3 times a week around a family dining table leads to healthier outcomes for children. So whether that is a baby or a teenager, it's a good thing to do. Life gets really busy, but kind of really making sure that that becomes a priority and that you're sitting together and you're role modeling is such an easy thing to remember. And then, so just role modeling is a big one. And then really encouraging a lot of the exploration. So not clean your plate, even as a baby or even as a toddler, really let's just try a bite, or let's just touch the banana. Let's just, so really, again, when we think about picky eating, I always try to encourage parents to understand there are really normal developmental kind of ups and downs that happen when it comes to eating for children. And so it's normal. It's normal to like something one day and not accept it for another week, and then kind of like it maybe 3 months down the road. Remember, it takes up to 15 exposures to food for someone to even try it, for a child to try
I feel like just like say that again for people in the back.
it. It can take up to 15 exposures for just like an average child to really accept the food. So don't think that it has to be right on the first time. Don't think it has to be right on the 10th time. And so again, relieving a lot of that pressure with all of these little tips and tricks, I believe actually leads to less picky eating. Because again, picky eating is it's kind of a little bit of a misnomer, because every kid will at some point be picky and choosy, and just like we are. But as long as they are, again, going to your pediatrician and seeing, like, is their growth appropriate? Are they meeting their developmental milestones? So if we feel really relaxed about how your baby is growing, a lot of times we get parents who come in and it's like, oh my gosh, they're a picky eater, they're not growing. And I'm like, oh, but look at their growth chart. Yay!
It's like science.
And they're reaching for objects and putting it towards their mouth, and they're doing all the developmental milestones. So I think that's, from a high level, really role modeling, kind of taking some of that pressure off, and really understanding that a lot of this is exploration versus nutrition, are key concepts. But here, if you want to talk about more specifics and nitty gritty too, in terms of picky eating, like.
Yeah, I couldn't agree more with everything you said, though. I think that is the most important place to start, especially with younger eaters, new eaters at the table. I think there's all this research that suggests certain things are important along the way, and that we have, as parents, some amount of control over those things. So like you were saying, coming to the table together, modeling, sitting down together, creating a joyful space where you want to be and your child wants to be, showing them how it's done. We know that serving a wide variety of flavors and textures, especially between 6 months and 12 months, is very important. The more a baby is exposed to textures and different flavors during that time, which is a period where developmentally most babies are wide open, very excited, very interested, very curious.
Spices. That's
Exactly.
yeah.
Yeah. It's
And
so
around the
many different
world,
things.
they're introducing some of these spices
Exactly.
very early on. Like I introduced a lot of spices in my Indian kitchen, like much earlier than.
And it's amazing. Yeah.
Yes, we don't in toddlerhood, you mentioned this, there is a developmental period where it shifts from being wide open to these experiences with very little brake pedal around it, just like, there's a shoe on the floor that's dirty, I'll put that in my mouth. There's a dog toy that the dog just dropped out of their mouth, I'll put that in my mouth. And little by little, we start to naturally develop a sense of disgust around certain things. So toddlers are much less eager to put things in their mouth. They'll still do weird things like put a shoe in their mouth, but they tend to be much more skeptical about new foods and flavors, where 6 to 12-month-olds tend to be very open with they'll pick up things like a spider, or like things that we're like, no, don't put that in their mouth.
Yeah, of course.
Put it in your mouth. So that's a time when we really want to introduce a lot of wide varieties of flavors and textures and foods, because we know that they're open to them. And the more a human, as an adult, it's the same thing. The more we are exposed in a positive environment to a food or a flavor or a texture, the more familiar we become with it, and the more likely we are to learn to enjoy it. So those foods and flavors that are introduced often during those first 6 months of starting solids tend to become the flavors that we go back to again and again in toddlerhood, and then through childhood, and even as adults. So it matters that we spend time introducing those foods and that we do those things. And that can feel like a lot of pressure on parents who are like, oh, now I have to introduce so many flavors and textures and foods, and I don't like to cook. And what if I don't do it right? What if I don't do it perfectly? So I think there is that balance of recognizing that babies develop at their own rate, at their own time, and there's no perfect pathway to do all of those things. So coming to the table joyfully and just eating the foods and flavors that you love, alongside baby is one of the easiest ways to accomplish that. So I like to think about if you have an older child and you wanted them to play soccer, you're probably not going to come to the soccer field and expect that they're going to get out there, run onto the field and kick a goal right off the bat.
Yeah.
But coming to the soccer field at first might be enough. You're at the soccer field and they're watching other people play. They're not even participating.
Yeah.
Well, they're having a nice time. They feel good. They're safe. They're with you. They're enjoying themselves. Little by little, they're coming to the soccer field and they might kick the ball around a little bit or throw it or touch it. And so they're starting to ease their way in. It's the same thing at the table. They may be coming to the table at first and not touching the food, doing anything with it, but they're smelling it. They're seeing it. They're watching you interact with it. They're seeing what happens at the table. And that is positive experiences that are helping them understand what what they should be expected to do, what the food does when it touches their hands, when it gets in their mouth. They're slowly learning and building skills. So sometimes you have really resistant babies who need to go extra slow. And often those are the parents who are the most nervous and who think that their baby is not getting it. So you start pressuring a little bit, you start pushing a little bit because you're like, I heard Kary say that food textures and flavors were so important during those first 6 months, when in reality, just getting your baby to the point where they're proactively interested in it is the first step. So we can't force that first step. It's really important that we do that modeling and that we serve those foods, but let baby get there in their own time, knowing that breast milk and formula are the safety net during those first 6 to 12 months. It's an absolute safety net. And really, many babies need that safety net a little bit beyond that. So my daughter, for example, my oldest, who is a phenomenal eater at 12, was slow to figure out how to chew and swallow whole foods. So she was really into it. We did baby-led
The
weaning.
perfect mama for that.
Totally. And we worked hard at it. But even at 12 months, I knew that she wasn't ready for me to pull back on that safety net of breast milk because she wasn't ready yet with her chewing skills. And it didn't really click for her until closer to 15 months, when suddenly it was like a light bulb went off and she was like, oh, now I get it. And then I couldn't hold her back. She was eating me out of house and home, eating more than everybody else in the family. But they do have a safety net, and us showing up in a positive way, showing her that this was fun and exciting and that she could explore at her own rate and her own timeline was really helpful to getting her over the hump.
And I am no expert here, but what I will say that really helped me is a little bit of a hack where I had a mom friend around the same stage as me. You can do this obviously with it doesn't have to be a mom friend, any type of parent friend in the same stage as you are. And we kind of traded off cooking for each other. And because of that, my kid was exposed to foods that she would make at home, and her son was exposed to things that I would make at home. And that was really nice for us, and honestly, like a really good bonding experience for the two of us.
And efficient.
And efficient. I am so sorry because we started late because of a technical difficulty. So instead of adhering to the script that we have, I'm going to just read some of the questions starting to come in from the chat for the sake of time. And one of them I think connects to choking, which I wanted to get to anyway. So my son is 6 months old this Friday. I'd gotten him the up seat as I heard they were good for healthy hips. I'd watched the Solid Starts videos that say you need their feet to be completely flat. Is that correct? I shouldn't be using the up seat with a tray.
You can totally use the up seat. There
Okay.
is benefit to having your baby have something to push their feet into because it gives extra support to the body. But the up seat in and of itself is similar to a bumbo-ish, is that it provides a lot of support to the trunk already. So baby might not need something to push their feet against and all that support around their hips and waist. So it's probably fine. Babies are so resilient and so capable. You will know if your baby starts to show you they're uncomfortable in the up seat, which it is, again, a lot of support around the hips. And the one thing that as an occupational therapist, I would pay attention to is that in those seats, sometimes, trying to see if I can show it from the side.
I feel like I'm understanding the hip.
Yeah, like baby's hips can be tilted slightly back so that a little bit more like this instead of sitting up like this, which can make, if you're even a little bit further back, it can be hard to reach out and hard to bring your arms up. So if you are finding baby seems like they're having a hard time picking up food, or they're disinterested in picking up food, they're dropping food a lot, they're not able to bring it to their mouth, or they seem to get fussy very quickly in the up seat, I would move them into a different type of seat where they're sitting up a little bit straighter, their hips are not tilted back, but they're more upright and forward, and they have something to push their feet into. But that said, I've worked with thousands of babies across a variety of homes and situations with all different kinds of seats. Most babies are pretty resilient, and it doesn't matter. They do just fine in those seats. But those are the things I'd look for to say, maybe switch them into something else.
And I love the tip you've given of the baby sitting on your lap. And in that scenario, their feet aren't pushing down on anything.
Exactly. Because your body is providing a lot of support to their back and their trunk and their hips, they don't actually need their feet to be flat and pushing into it. That's kind of like what the upseat is doing.
Yeah, I learn something new every time, because my assumption was the feet being flat was for choking. So great that it's not, but can we talk about choking a little bit? And
You're not completely wrong. The more upright you are, the more your trunk is supported, the better you can breathe, the easier it is to manage food in the mouth and move it in and out. So it connects to choking. It's not necessarily like your baby's going to choke if they don't have their feet flat on the floor, but it gives them a stronger base of support for the respiratory system, which makes them have an easier time with eating.
All
right, talk to us about those. Oh, go ahead.
I was going to say, on solid stars, I think you guys have some good videos too on kind of choking versus gagging, because especially at this age, it's super important to understand the difference. And, you know, in terms of, and I can, you know, Kary can explain more too, but in terms of gagging, it's a natural reflex, like it is a protective mechanism within an airway. And so gagging is actually what your baby should be doing. Choking is actually where that food is now blocking the airway, and that is an emergency. And so we really recommend that all parents really get infant CPR certified. You know, a lot of and you don't necessarily need certification, but you really certainly need to recognize signs of choking, and then what to do in that scenario. But I think that maybe deserves a little bit of a Kary, if you have anything else on choking versus gagging, because I know that causes a lot of anxiety for parents too.
Yeah, absolutely. I think that's a great one to tee up. I think you basically described it, but the gag reflex itself, we call a protective reflex, partly because it keeps food very far forward in the mouth. When you and I have food or a toothbrush or something that hits the back of our mouth, it'll cause a gag response. But for infants, it's closer to the front 2/3 of the mouth rather than the posterior third of the mouth where it is in an adult. So it starts to move further back as a baby gets closer to 12 months and into toddlerhood. But at first, it's really far forward in the mouth, which keeps food and any object that isn't really a watery, thin puree very far forward in the mouth. And even purees at first, which are slightly thicker than, say, breast milk or formula, can cause that gag response to happen when those purees start to spread around baby's mouth. So the gag reflex is a very powerful reflex that keeps food in the mouth. And when a baby gags, it physiologically closes the airway. So the first thing that happens is the airway squeezes shut because the body wants to protect the airway in the event that you should throw up. But you don't want to get vomit into the airway because it can be very acidic for the airway and cause a really severe reaction. So the body closes the airway, which makes sure that anything that's in the mouth or in the back of the throat at all cannot get further down into the airway, as everything starts squeezing bottom to the top and the tongue starts pushing forward. So a gag response, although it looks rather uncomfortable and a little bit scary, is completely normal, and it is a safety response. It's a good thing for baby to do as they work that food out. In contrast to that, you already mentioned this, but a choking response is when something has gotten into the airway and is plugging the airway. And your baby still has lots of protective responses that they can do from there to move it forward. They can cough and continue with the gag to get it out. But what usually needs to happen in that situation is adult intervention. And we know that choking rescue with a firm back blow for baby or firm back blows can be highly effective in the rare instance that baby is actually choking instead of gagging.
Got it. That is really, really informative. Okay, switching gears a little bit. I feel like this is like lightning round, but what are your thoughts on rice cereal to start introducing food? My pediatrician just suggested it yesterday at my daughter's 4-month checkup.
I'm obviously a pediatrician. There's a lot of training that we get. Um, it kind of goes back to everything. I think the theme of tonight is traditional training versus kind of more new training. So we used to say, start with rice cereal, start with, purees and then thicken it. And so, you don't have to do that. You certainly don't have to start with rice cereal.
Yeah.
I think, it's one of the easiest ways to kind of thicken, have just like a more pureed food to start with. That was more of the traditional thinking. And so if you don't want to, you don't have to. It's kind of my philosophy. And I think, when we do think about what does your baby need at this age, it's iron, it's vitamin D, and it's, a wide variety of textures and flavors. So that's what I have to say about that. And I think that a lot of my fellow pediatricians might still be giving a lot of those recommendations just because the training still has not quite caught up in full disclosure to a lot of what we know now, even in kind of this food as medicine, food as health space. And one other quick plug is, really introducing your child from a baby stage to a toddler stage to as many fruits and vegetables. When we see kids, it's like 90% of children in the United States of America do not consume enough vegetables. Like they don't consume the amount of vegetables that we need for their body. So going back upstream, this time in a baby's life, in that time, this is the perfect opportunity to kind of introduce lots of different varieties of fruits and vegetables without pressure. My daughter still won't eat kale, but she loves spinach, And so
Win. That's a win.
And so they don't have to eat everything, but really kind of making sure that half that plate as they grow up are fruits and vegetables. That kind of, again, goes upstream to what are we doing in the baby stage and really trying to expose them to that. So I just wanted to do a quick plug.
No, that's
cereal.
Yeah, it sounds like you don't need rice cereal is what I'm hearing through, but if it makes you more comfortable, then of course, do you. Now, as your child starts eating more and more solids, that may mean that they're consuming less and less breast milk or formula. So how does one balance solids versus formula or breastfeeding? And yeah, I'm gonna leave it there.
Yeah, I'll let Kary take this since your background on both of those.
That's perfect. You can back me up on and make sure we didn't miss
You guys
anything.
are a great tag team, by the way.
I know it's so fun. I always learn so much too. It's such a nice conversation. But this is an area where breast milk and formula are baby's safety net because they are learning a whole host of really complex brand new skills. So I think parents really believe they're going to come to the table and, day one, do I start giving less formula? Do I start offering breast less? But just like at that soccer analogy, you're not going to bring your baby to the soccer field and have them run out there and do everything. At first, they're just going to be crawling around, and then eventually they're going to stand up and run, and then eventually they're going to run faster. You need to give them lots of time and practice. So there's often no change at all to breastfeeding schedules and bottle feeding schedules and quantities in the first few months or several months of starting solids as your baby is figuring it out. And for babies that are very quickly dropping the amount of bottles they're taking or the frequency with which they're breastfeeding, at 6 and 7 months, I always ask questions to the family around what are we offering? Because usually that to me tells me they're probably sticking with easier textures. So breast milk and formula are very similar to thin purees. They're watery, they go down in the same way. Babies can sometimes pick it up very quickly and run with it. Like, ooh, these are good. I like these and I know how to swallow them. So they'll start taking, several ounces per meal, and families that are eager and excited can sometimes find themselves in a situation where baby has now dropped breast and bottle feedings a little too quickly because baby prefers the purees and the spoon feeding they're getting at the table. And we know that breast milk and formula are really important for baby's nutrition. And usually purees are not as calorically dense and nutritionally dense as breast milk and formula. And we know there is still a giant leap that baby needs to take to get from eating purees on a spoon or even with their hands to the place that they can chew and swallow a wide variety of textures and foods, such as what the family is eating. So even if baby is ready to take more of those solids at first, we really recommend focusing again on building baby's chewing skills, serving a wide variety of textures that are chewable, and not touching the breast milk and formula, or at least pulling back on purees if baby seems really interested in them, and serving more finger foods so baby builds those skills. And what you want to aim for is that somewhere around 9 to 12 months, 13 months, 14 months for some babies, baby should naturally start to take less bottles or less breast milk in as they're learning the skills of how to eat a variety of foods, and they're starting to learn that, oh, these foods fill my belly. So the 6-month-old puts a piece of food in their mouth in the same way that they pick up a toy and put it in their mouth. They don't understand that this food is going to fill their belly, but somewhere along the way it will click for them and they realize, oh, this actually feels good and fills my belly. I can eat more of it. And then they slowly start to take less breast and bottle feeds.
Got it. You two have been so generous with your time, so I want to make sure we just get these 2 questions. There's a few more that haven't been addressed, but I promise in the recap email that you get, and I'll send this recording as well as a previous recording we've done with the same crew, you will get your answers. Just quickly, you mentioned the three allergen introductions in the same day. If someone didn't do that and they introduced salmon, can they go back and then start the 3 times in one day over again?
Yeah, absolutely. Although if you've introduced salmon and you think baby isn't having an issue with it, you can absolutely just start introducing salmon. Those are kind of more conservative ways to introduce allergens very like carefully and thoughtfully to make sure baby isn't showing an allergic reaction. But I think there's a lot of people who are like, oh, I didn't realize that was the case, and I've just been serving salmon. If you're serving salmon and baby isn't having any reaction to it, you're fine. You don't need to go back and do those 3 days. The other piece of that that Dr. B likes to really suggest or make sure families understand is that the research is fairly suggestive that you want to keep those common allergens in the diet on repeat through age 5 to get maximum benefits for reducing food allergens. So that could mean you might want to go back and introduce salmon again and again, just because you don't want to say, oh, I did it, those 3 days and I'm done. You've got to kind of keep it in the diet up to like around 3 days a week, ideally, for most of the allergens.
Amazing.
Which is a little hard.
Yeah. This is just a really quick one, and I feel for this person. My pediatrician recommended I feed my baby pureed meats. I'm a lifelong vegetarian. It feels so strange to feed him something I don't eat. Do you know of any alternatives to meat purees that can give my 7-month-old the same nutrients?
I have so many opinions on this because I'm a pediatrician and I'm vegetarian and my kids are vegetarian.
Yes, this is the perfect audience.
I was like, no, don't worry.
Yeah.
That mom, just no, there's a lot of different sources of protein. And so you can get it from plant-based sources as well. We eat, my children eat a lot of, lentils, you do dairy. So you don't have to do meat for your children. And especially like in a lot of the South Asian cultures, there's a lot of vegetarianism that happens. So meat is not something that you have to introduce. But as long as you are ensuring that there are vitamins and a good source of those things that are otherwise found in meat, like, B12, things of that sort that are commonly found, that you also find them in plant-based sources. And so don't feel like you have to start meat. And certainly, I think we talked about it before, don't feel like you have to start with pureed. I know I've seen the most adorable videos of kids just chomping on some of those chicken. And so it doesn't have to be pureed either. And those textures and those developmental kind of skills are so important for babies to learn.
Well, thank you both so much for such an amazing conversation again, and for your patience with Auggie as we dealt with a technical issue. And I'm sorry to people if it was stressful in the beginning trying to sign on, but I promise you will get all of the information in your inbox and in your Auggie DMs. So we will see you there. And on that note, till next time. It will
Thank
be
you.
for my personal baby. So I'm so excited.
Oh, good luck.
Thank you. All right. Have a great night. Bye, everyone.